I apologize for being a little late, but how does this differ from the TURP? Or is it similar?
TURP procedure? The TURP is really a completely different animal. A TURP you use to treat just enlargement of the prostate, nothing to do with cancer. It is used to treat when you have enlargement of the prostate that is causing poor emptying of the bladder, causing urinary symptoms like frequency, poor flow, waking up at night often. If that's determined to be the causes of the prostate, we can shave down the prostate. It's the old roto-rooter. We shave down the prostate to enlarge the channel that you can urinate and pee more freely. HIFU is used to treat cancer. Now, it can be used to treat enlargement of the prostate as well, but for tonight's purposes, we're really talking about cancer. After the procedure is performed, most patients recover relatively quickly within a few days or back to basically their normal lifestyle. We'll talk a little bit more about your experience and kind of share your thoughts as well. You do have a catheter, unlike surgery where the catheter is in your penis for a week or so. This catheter is actually a suprapubic tube where it's placed through the lower abdominal wall into your bladder. It's there for, on average, 2 to 4 weeks. We check your PSA every 3 months for the first year and then every year after that. This is a little busy slide, but basically these are some of the sort of early results from the HIFU. The top row here is HIFU. This is a radical prostatectomy, and then this is external beam radiation. And the results are good. The results are very promising. Again, this is young data. We don't have the good 20, 30-year data that we do for prostate surgery and for radiation. But data we have now is actually very encouraging. On the right column here, you can see 94% biochemical disease-free survival at 4 years, and actually even better results on the next slide at 6 years. What that means is basically at 4, or the next slide would be 6 years, you have a 94% chance that your PSA is going to be undetectable, that you won't have failure from your PSA. At 6 months, the biopsy rate is negative in 87% of the time. So it really does kill the prostate, kill the tumor cells. If you look at this column here, selected risks, the really exciting part is that, again, we're having less side effects as far as incontinence and impotence. Incontinence rates 0 to 2%. You're going to see that higher, although we're better at that regarding surgery and radiation. It is higher in those two treatment modalities. Impotence 20 to 30% versus higher rates for the other modalities. The problem with impotence rates is that it depends what your definition of ED is, and the results are all over the board. Anything from some people claim 5% to 75%, and it depends what your definition is. It can be with Viagra and Levitra, without Viagra, Levitra, firm erections enough to penetrate. There's so many definitions it can be difficult to quantify. So that can be a problem when you're comparing one to the other. Again, some more results. Negative biopsy results, rate at 1 year, 91%. Again, what's the risk? You have 97% chance that your PSA is going to be undetectable at 6 years. So good, again, promising results that are still young. Again, no matter what treatment you use, there is potential for side effects, and that includes HIFU. This is not a magical treatment. I'm not promising you the world here. There can be some side effects and complications. Again, erectile dysfunction and incontinence do exist with this treatment. Other things that you can have are frequency and urgency, some discomfort and discharge from your penis over the first several weeks, and that's due to the sloughing of the tissue. The tissue dies and needs to come out somewhere, and it gets sloughed off so you actually can urinate that out. You can have some fistulas and strictures, although we're at the 3rd generation of this tool now. Those rates are minuscule, well under 2% of the time now. This must be an expensive treatment, you're thinking. All these sexy tools and lasers. In fact, it's the cheapest treatment there is. If you look at it, again, these rates can vary, but it is much cheaper than prostatectomy, especially using the robot. It is cheaper than radiation therapy, far cheaper than proton beam, and cheaper than cryotherapy. Again, like we talked about, it's not FDA approved, and we'll go into that. I think it's on the next slide. Therefore, insurance companies will not pay for it up front. That being said, there are a lot of patients that, and this probably, they try not to have us tell you this too much, but for the most part, there are a lot of patients getting it paid for on the back end. Do the procedure and they get paid for it on the back end because insurance companies love this. They don't have to pay as much. And when it gets FDA approved, the insurance companies are going to be all over this, assuming the results pan out the way we want it to. Like we talked about, this is important. It is not FDA approved in the U.S. It is approved for the use of fibroids for women, but not approved for prostate cancer treatment in men. Hopefully that will change in the next 1 to 2 years. There are phase 3 trials ongoing now that hopefully these will be approved. So you do have to travel outside the U.S. to get this done. The experience itself, and again, Mr. Messick will speak from his point of view, but the team is made up of Americans, American physicians, American technicians, American nurses, just performing the procedure outside the U.S. The only part of the team that sometimes is not American is the anesthesiologist, but they're all trained in America anyway. But for everybody else, American, travel to wherever, come back and they travel with you. You get a confirmation packet, detailed instructions on what to expect before, during, after. You meet with the team the night before, usually with the doctor the night before as well. They walk you through what to expect. And 24/7 access to the team while you're there. The team will drive you to and from as well during the stay. Where are they offered? Bermuda just opened up this past summer. I'm familiar with the one in the Bahamas. There are some sites in Mexico as well as Dominican Republic and in Canada. There are, as you can see, these are fantastic places to travel. Believe it or not, patients go for vacation. They go early, they take their family, they stay late, they use it as a vacation. I thought it was a little strange at first myself, but you can actually go, and because you return to lifestyle so quickly, there are stories where patients are down at the pool the night of or the morning after having cocktails with their family. You can't necessarily go swimming that quickly, but you can at least sort of share the fun. This is the site in Bermuda. This is the Memorial Hospital there. This is the Doctors Hospital in Nassau. This is where we went. And this is the site in Cancun, Mexico. Some of these look like 4-star hotels. So the reason I show these to you, these are not little shacks. They are as nice a hospitals as you're going to find here in the U.S. I thank you for listening. I thank you for your attention. I thank you for coming and braving the cold. If you have any questions, feel free to give me a call. Michelle will answer the 7017 number. You can call her if you want to come in and have a sort of a personal talk with me. You're more than welcome to. The website, MarylandProstateCancer.com, to get more information. Some of the information I talked about. Feel free. Any questions at all? Anybody confused about any parts?
Just one question. You mentioned on a slide that this procedure is designed to treat the prostate gland. Mm-hmm. So if you've had prostatectomy and it's gone, what does it focus on?
It wouldn't be used in that respect. Right. They're similar to what we talked about before. If sometimes a prostatectomy can be performed and some of the tissue will be left. The surgeon didn't or couldn't remove all the prostate. There was some left over. If it's believed that that is the reason for the failure, that the PSA is elevated because of that, it could be used to treat that. But it would not, at least at this point, be used to treat the prostate bed or the surrounding areas. I don't think anybody would treat that as of now.
When are you looking at FDA approval?
I've asked that question many times because it would allow me not to have to travel down to these sites, and I can actually stay home and do this. But it can be a time-consuming process. When I asked them a year or so ago, they said in a year or so. Now it's a year or so. So there's a lot of politics involved. Unfortunately, there's a lot of they need to look at the phase 3 trials, which aren't finished yet, but they recruit very well. I'm told at this point a year to 2 years. Things can change. It may get a little before that, but may get pushed back. So hopefully 1 to 2 years.